Likely be one of the shortest videos of the semester. We're not going to spend a lot of time on this in lecture. However, there will be an activity associated in lecture with this video lecture that will allow people to earn extra credit for exam 3. So, one topic, one outcome. So here we go. Remember, there are 3 types of blood vessels. We talked about that with the first lecture of this group. So we've got arteries, capillaries, and veins. Okay. So, arteries transport blood away from the heart, almost always are oxygenated with the exception of the pulmonary artery, which is shown right here. And then capillaries are where gas exchange, nutrient exchange, waste exchange occur, and it's also the connection between arteries and veins, so shown here and here. And then veins transport blood to the heart, generally deoxygenated or oxygen-poor blood, with the exception of the pulmonary vein. Okay. Now notice that we've got 2 circuits. We've got the systemic circuit, which goes from left ventricle to right atrium, going through systemic capillaries. So this is capillary. These are capillaries found in my big toe and in my brain and everywhere in between. And you've got the pulmonary circuit, which goes from the right ventricle to the left atria. And in that case, blood goes through the pulmonary capillaries where they pick up oxygen and get rid of CO2. So, when it comes to the pathway of blood through the heart, it is as follows. And I'm going to have different colors for if it's oxygen rich or oxygen poor. So, blood enters the heart through the vena cava, which is a vein and does not have a lot of oxygen. Right atrium, tricuspid valve, right ventricle, pulmonary valve, which is a semilunar valve. Okay, the tricuspid valve is an AV valve. It then enters the pulmonary artery, still oxygen poor. Goes through the pulmonary capillaries where gas exchange, nutrient exchange occur. Well, gas exchange primarily. So we pick up oxygen, we get rid of CO2, and so now we're in the pulmonary vein where that blood has lots of oxygen, so now it's red. It goes back into the heart, into the left atrium. From the left atrium, it goes through the left AV valve or the bicuspid valve. Remember, you try before you buy. Then it goes into the left ventricle. From the left ventricle, it goes through the aortic semilunar valve. And from the aortic semilunar valve, it goes into the aorta, which is the largest artery. It's about the size of your pinky, and out to the rest of your body, where it will eventually come back into the vena cava and do this all over again. Okay? So I know that this is review, at least it has been for the past several years. So can you do the following 2 things? Can you trace the path of blood through the right and left sides of the heart? And can you tell me if it's oxygen rich or oxygen poor? And remember, there will be something in class that you can do to earn extra credit based on this lecture.